Good evening, sir. Good evening, all the aspirants. So, shall we start the session?
Okay, thank you.
Uh, yes, sir. So, aspirants, this is going to be a CCS session and a really interactive session. And the speaker that we have here is Fathy Elshazly, sir. So, you may take over. Thank you.
Thank you so much, Fatima. Welcome again, and I hope that your studying is going well, and you are well prepared for the exam in next November, hopefully. My plan was to do a long case and short case, but the organizers asked me just to make it 1 hour today. So, because I know it's too late now in the eastern part of the world, so we'll start with the long case, and if we have time, then we can go quickly with the short case as well. So, as I mentioned before, this is supposed to be interactive session. It's useless if you're not going to interact, if you're not going to try to answer the questions, because that's what it's all about, and that's what matters actually. That we have to practice. The exam is not about knowledge. This exam is not about knowledge. It's about how to show to the examiners committee that you have experience, that you know what you're doing, and you are safe to practice intensive care medicine in Europe. So I would like one of you volunteers now to start reading the scenario, please. So, any volunteer?
Yes, I will volunteer.
Dr. John, okay. Would you mind reading the scenario, please? Usually you have 1 minute in the exam to read the scenario, okay? Usually they give, I think, more than 1 minute, about 5 minutes to read the scenario or so, and then they start asking the questions. So, would you mind reading the scenario loudly, sir? Just the vignette. Don't care about the numbers, about the numbers, but just read the vignette and then have 30 seconds to think about it, and then when you are ready to start asking the questions, we will start. Okay.
All right, sir. A
Thank you.
28-year-old male, height 1.6 meters, weight 60 kilograms, previously healthy man, presents to the emergency department with rapidly progressive shortness of breath, high fever, and hemoptysis. History. He has 1 week ago, he had a flu-like illness. He smokes occasionally, but no past medical history, no recent travels, and no immunosuppression. Okay. Should I go ahead with the physical?
Okay.
Okay. On arrival, his temperature was 39.5, heart rate was 132, blood pressure 88/50, respiratory rate was 30, SpO2 was 88% on 15 liters using non-rebreather mask. He was fully conscious, GCS 15/15. Physical examination shows that he had diffuse crackles, both lungs, with pink frothy sputum, with blood streaks, mottled skin, and delayed capillary refill. Okay, so the X-ray is as shown on our right.
Would you mind interpreting the chest X-ray for us, please? But ignore the tube, which you can find it. Ignore the endotracheal tube, but just let us see your interpretation of the chest X-ray.
The chest X-ray shows woolly infiltrates, that is woolly dense infiltrates in the apical region, right apical region, as well as in the right lower and left mid-zonal areas of the lungs. Woolly opacities.
Okay. Yeah. Okay, based on the chest X-ray, based on the clinical symptoms and sign, and based on those numbers which you are seeing, what's your differential diagnosis?
Well, I'll make a start with lobar pneumonias. Yes, lobar pneumonia, and he might also have
Do you think it's loop or pneumonia? Is it confined to one loop, or it is bilateral pneumonia? Bilateral bronchopneumonia.
Okay, yeah, bilateral pneumonia, I would rather say.
Okay,
Bilateral.
what do you think the cause of this pneumonia? What else other than pneumonia first? What else other than pneumonia?
What are the
other pneumonia? Bronchopneumonia is your first official diagnosis. What are the other causes of this picture and this chest X-ray?
Well, it may be viral in origin, and it's also possibly fungal. Fungal pneumonia is also possible from this this picture.
Okay, other than infectious causes, what else? Any other non-infectious causes you can think about here?
Perhaps pneumoconiosis.
Pneumoconiosis, okay.
Volume overload.
Volume overload, yes, okay. What else?
COPD.
Maybe
aspirator. COPD, asthmaticus, yeah, status. Asthmaticus.
What else?
Bronchiectasis. Malignancy.
Okay.
Then aspiration, right side
Goodpasture syndrome as well, because the kidneys are also involved.
Great. Goodpasture syndrome, or any cause of vasculitis, or autoimmune, because here we can see that he's got pinkish frothy sputum,
pulmonary hemorrhage,
blood streaks, there is thrombocytopenia, there is neutropenia. So all of this, pulmonary hemorrhage, alveolar hemorrhage, all this can be a differential diagnosis. Okay.